Cases of measles continue to spread across southern Ontario. The public health unit in Wellington-Dufferin-Guelph confirming the area's first case of the virus earlier this week. Let's discuss with Dr. Nicola Mercer, the medical officer of health in Wellington-Dufferin-Guelph. Thanks for your time, Dr. Mercer.
No, thanks for having me to discuss this really important topic.
Yeah, it certainly is. It's a big topic right now, of course, for us here, many communities across southern Ontario too. So can you kind of give us the latest update on what the situation is there locally?
So locally, we actually are confident that we actually have more than one case. We actually have, just as of today, confirmed another family that's involved. But I think for people who are listening, I just don't want people to think that you could just see measles just in any old place or that wherever you go. I don't want you to be fearful of that. I want you to know that measles cases are showing up in those who are under-vaccinated or unvaccinated. So those are the communities where you're really going to find cases of measles. And for those individuals, or those of us who are walking around with 2 doses of measles vaccine, or potentially you were born perhaps prior to 1970 and you had measles, then you are protected from measles.
Okay. You kind of talked about how there may be more cases popping up as well. Are there certain locations that you're aware of that may be exposure sites at this time?
Well, we are tracking locations, but I think it's really important for people to not look at a map and say, oh, if I don't go to those places, then I'm safe from measles. I think if you are unvaccinated, then you should assume that you are always going to be at risk of measles in a variety of places that you may go about your work or school, for example, or whether you travel internationally. So if you're unvaccinated, there is no way to safely protect yourself across Ontario or other parts of the world. You will be exposed to measles because it's now becoming very common as our vaccination rates have dropped, especially following the pandemic.
Okay, we also have March break coming up. How concerned are you about the rate of the spread of measles really across southern Ontario at this time and kind of the timing where March break is fast approaching?
So if you are a family, you have children, I think the number one thing I could say to you is make sure you know your child's vaccination status. So if you're not sure, you got to speak to public health, or you can speak to your family doctor or look at that yellow card, the vaccination card. Your children need to have 2 doses of a measles vaccine. So it's called MMR, MMRV, but you need 2 doses. If you were born between 1970 and maybe about 1980 in that range, you may only have actually had 1 dose of a measles vaccine. So you probably should have a 2nd dose. And everybody who's had 2 doses of a measles vaccine, you should be confident that you're safe and that your children are protected. Now, we know the 2nd dose of measles vaccine is normally recommended to be between age 4 and 6. But you know what? Get it closer to 4, especially if you're traveling or your children going to communities where you've heard there's a lot of measles. And there are in some parts of Ontario, some areas we're seeing a lot more cases of measles. But if you have those 2 doses, that you're good. If you have a child under the age of 1 year who has not been vaccinated, please be much more careful. Speak to your family physician, your nurse practitioner, if you are traveling to an area where there is measles activity, because there is a possibility your child may be eligible for an extra dose, but for everybody else, just make sure you've had 2 doses.
Now, I want to touch on something that I have seen online a bit. Parents dubbing this measles parties in a way to kind of do herd immunity. We've seen this before with maybe chicken pox. Is this something that is a big concern for you right now?
Well, we're not seeing a lot of it, but let's just talk about what the idea is. So the idea is to actually expose your children to an infectious disease like measles in order to give them natural immunity versus vaccine immunity. So the first thing is that if you get good immunity with vaccines, and those are the 2 doses, you are immune. You do not have to actually experience the the symptoms, the side effects of this disease to get immunity. So it really seems to me like it kind of bothers me that you would make people suffer to get immunity when we have vaccines that will prevent you from getting that disease. And then secondly, if you get the disease measles, it is not an innocuous disease. We know, especially for very young children, we see a significant proportion of those children ending up in hospital with pneumonias, ear infections. You can go deaf from having measles, and you can certainly get meningitis, encephalitis, or some other nasty neurological, long-term neurological complications from measles. So, and unfortunately, we get the odd child who actually dies from measles. So with that in mind, I don't recommend, actually, I strongly discourage the concept of any kind of infectious disease party, whether it's chickenpox or in this case, measles. They're not the best way to protect your children from an infectious disease.
Well, it's important information and, of course, a very important discussion at this time. Dr. Mercer, thanks for having it with us. Thanks for sharing the updates on the situation locally as well. Appreciate it.
Thank you for having me.